I would like to acknowledge the traditional custodians of country throughout Australia. I recognise the continuing connection that Aboriginal and Torres Strait Islanders people have to their lands and waters, and I pay my respects to elders past and present. I would also like to specifically pay my respects to the Wurundjeri people of the Kulin Nation as the traditional custodians of the lands on which I live and work. Sovereignty was never ceded, always was, always will be Aboriginal land. Hi, everyone. My name is Simone Condon, and I'm the Gender Equality Lead with the Australian Volunteers Program. I'm really pleased to welcome you to the first session of the second webinar in the Sexual Violence Research Initiative's virtual series, Voices from SVRI Forum 2024, Strengthening the Field Through Shared Learning. We're proud to co-fund this series and value our ongoing partnership with the SVRI and their commitment to advancing research to end violence against women and violence against children. Over the next few months, this series will unpack some of the key findings and themes from the SVRI Forum 2024, including topics that many of our partners expressed interest in after attending the forum. Today's session continues that conversation, focusing on strategies for women's economic empowerment that are safe, inclusive, and impactful. Just a few quick housekeeping notes before we begin. So today's session will run for 1 hour. All of our sessions are being recorded and they'll be publicly shared on both the SVRI's and Australian Volunteers Programs platforms. The audience is muted today, but we'd love for you to introduce yourselves in the chat. If you could please let us know your name and where you're joining from. And we very much welcome your questions and reflections throughout. So please do feel free to use either the Q&A box or the chat. We will do our best to bring as many of your questions into the conversation as time allows. And a quick look at our agenda. So we'll be beginning with an overview of key economic empowerment related findings from SVRI Forum 2024. This will be followed by a moderated panel discussion with our invited speakers. We'll then move into a live Q&A with your questions. And finally, we'll close with the next steps and share the upcoming webinar in June. Before we get into the discussion, I'd like to invite Joy Watson from the SVRI to please share a high-level overview of forum findings related to women's economic empowerment. Over to you, Joy.
Thank you so much. Good morning and welcome everyone, or good afternoon, wherever you are in the world. The presentation I'm about to do draws on the emerging evidence and the lessons shared at the SVRI Forum 2024. And Liesl, if you may move to the first slide for me, please. So really, we tried to pull together essentially four lessons, so they're categorized under four sub-themes. And we wanted to highlight the intricate relationship between women's economic empowerment and the prevention of intimate partner violence. In this sense, women's economic empowerment refers not only to income, assets, and opportunities, but also to women's ability to make and act on economic decisions, which is key to reducing to shifting power dynamics both within households and across communities. Really looking at within that cycle of violence, how best we reduce financial dependence within relationships. Importantly, if done well, this can contribute to long-term poverty reduction, and importantly, programs that look at women's economic empowerment are most effective when they're designed to enhance women's agency. Next slide, please, Liesl. So I'm going to start with the first lesson learned, which is about economic security can only be reduced if IPV is sustained, so as opposed to ad hoc initiatives. And here we looked at the transfer modality research in Bangladesh, which is a 9-year study exploring how different forms of economic support affect IPV outcomes. What this showed us is that when women are empowered to make and act on decisions about their own economic lives, we see benefits not only in terms of reduced vulnerability to violence, but also in their ability to participate meaningfully in household and community decision-making. So this multidimensional empowerment contributes to broader social change in the long term and long-term poverty reduction, especially when programs are designed intentionally to build women's agency. We can move to lesson 2. And here, one of the key insights from the forum was about group-based delivery, building power and connection. And in Ethiopia, we look at the Ethiopian Productive Safety Net Program, and we look at how group sessions strengthen financial security and social networks. That there was increased confidence and household voice for women when women's economic empowerment was connected to collective spaces and group-based delivery. So it's a powerful modality, and we see that in the PSNP, women participating in group sessions experience strengthened financial security and increased social support. And then importantly, these spaces became sites of connection, of confidence building, and shared learning. When women have access to peer support and are engaged in their communities, their voice within household also strengthens, reinforcing that protective impact of economic empowerment. And then we go to lesson 3, which is about economic empowerment programs. Unfortunately, can also trigger backlash. And, this is, it's something that we need to consider very carefully in working on women's economic empowerment, and looking at how without proper support in place built into the program, that women may face this backlash or an increased risk of violence. So here, gender norms training and community dialogue is very important to promoting shared understanding, and looking at the inclusion of both women and men to improve household relationships and decision-making to make economic empowerment safe, equitable, and sustainable. And then we go to lesson 4. Lesson 4 was about integrating IPV prevention into social protection systems. Social protection systems offer a powerful platform for integrating IPV prevention, but gender responsive design is inextricably linked to this. So merely cascading training through systems is not enough. To make a real difference, programs must include targeted tools, design, and gender-sensitive training that foreground women's safety and agency from the outset. Government-led platforms can drive scale, but only if the design gets it right. And we can go to the next slide, Liesl. So, what we wanted to underscore is the fact that policy matters very deeply. Education stipends, compulsory schooling, and legal reforms such as divorce law reform have shown very clear links to reduced IPV and greater empowerment for women. These structural interventions shift the broader enabling environment and they enhance safety and opportunity at scale. Policy reform, when feminist informed, is a lever for justice. And I just encourage us to really think about this, because one of the other things to emerge from the SVRI Forum was that, despite our growing evidence base, we are still seeing a huge gap between the evidence and using that for policy change. Next slide, Liesl. Finally, technology and media hold promise as tools for awareness, education, and access, especially for marginalized women. But again, design and delivery matter. When done well, tech supports dignity and it supports justice. We also know that it can heighten risks. But the key here is a sustained feminist approach that adapts to context and centers women's voices in the design of tech-driven interventions. I think that was the last slide, and we are wanting to just trigger your interest a little bit in SVRI Forum 2026, and I'm going to hand over to Liesl to entice you further.
I want to start my video. There we go. Thank you so much. Hi, everybody. I'm Liesl, and I work as the Partnerships and Network Manager at the SVRI. So thank you so much for joining us today. And I am absolutely delighted to invite you to the next SVRI Forum. It's going to take place at the Centara Grand and Bangkok Convention Center at Central World in Thailand from the 5th until the 9th of October 2026. So over the 5 days, we'll bring together researchers, practitioners, policymakers, donors, survivors, activists, all from around the world to share evidence, build new collaborations, and drive forward solutions to prevent violence against women and violence against children. Abstract submissions will open early August 2025, so please do start shaping your ideas now. Our themes were developed in deep collaboration with the field, so have a look at them, and I think Liz will share them in the chat, as these will guide submissions. So please do have a look. To stay up to date on submission deadlines, speaker calls, bursary opportunities, and more, please follow us on our social media, Twitter, LinkedIn, not X anymore. We are on Blue Sky, LinkedIn, Facebook, and Instagram at the SVRI. And then also on our forum website, we have a link to our newsletter. And yes, we can't wait to see you there. I'm going to hand back to Simone. Thanks.
Thank you, Joy, for that thoughtful overview, and Liesl for the exciting update on Forum 2026. Now, I would like to introduce our moderator for today's session, Sangeeta Chatterjee from the SVRI, who will be guiding us through the discussion and question and answer.
Thanks, Simone. I've really been looking forward to this important discussion on the role of economic empowerment and the importance of including gender transformative programming to see success in violence prevention programs. And without further delay, I'm very excited to introduce our panel today. Our first discussant is Samral Idris. She is a health economist at the Aga Khan University in Pakistan, and her research focuses on economic evaluations to support health policy and decision-making, and her interests span cost-effective analysis, women's empowerment, mental health, gender-based violence, and maternal and child health. Samral will share her research on a cash transfer plus life skills training intervention for couples in Pakistan. Our second panelist is Anna Maria Buehler. She is an associate professor at the London School of Hygiene and Tropical Medicine, and her research interests span gender-based violence, technology-facilitated abuse, masculinities, child and adolescent sexual exploitation. And Anna today will share findings from her research on another cash transfer plus program from Ethiopia. We're also delighted to have Fumi Fawole as our third panelist. She is a professor at the University of Ibadan in Nigeria. She's a community physician and has conducted research assessing the impact of gender-based violence prevention strategies among girls and young women, and also has done some work on economic abuse among women and girls in Nigeria. Fumi will share findings from her evaluation of a mobile app-based economic empowerment intervention with young girls in Nigeria. Our fourth panelist is Mahfouz Al-Mamoun, who is an assistant scientist at ICDDRB, which is a research organization in Bangladesh. He has research experience in different public health fields, including gender equity, sexual and reproductive health and rights, maternal and child health, violence against women and girls, child marriage, and mental health. Mamoun will share findings from a longitudinal study in Bangladesh. And to kick us off, my first question is for Mamoun. So over the 19-year period of your study with women from rural Bangladesh, what did you find most striking about how different economic and social risk and protective factors for domestic violence and how they evolve over the life course for your female participants?
Thank you, Shangita, and thank you all. So first of all, I want to thank SVRI for arranging this all important webinar. And this is a very timely one, I think. So, we are very fortunate to have a 19-year-long longitudinal cohort data on violence against women here at ICDDRB in Bangladesh. And analyzing the data, we found a number of striking findings. The results from this study actually showed that the correlates of physical and sexual domestic violence might be different at different time points in women's life. While some factors such as decision-making level and wealth index were common correlates of physical violence across different life stages, the effect of other factors such as age difference with husband varied by women's life stage. Similarly, when we analyzed data for sexual violence, we found that wealth index was a common correlate of sexual violence across different life stages of women. However, the effect of NGO membership varied from one stage to another. In fact, we found that NGO membership, which considers as a typical component of women's empowerment, economic empowerment, was associated with significantly higher odds of experiencing domestic violence at the late stage of women's life.
That's great. Thanks, Maman. And it's really interesting to see how certain factors, the role of certain factors shift with women's age. And it's important to think about how we can sort of remember that while we design interventions. And shifting our focus a little bit to thinking about how we can best design interventions to address these different kinds of risk and protective factors at different life stages for women. I'd like to turn to Anna and ask you, from your research, from what participants shared, how did the group discussions in the training component of your cash transfer program help shift relationship dynamics or build stronger partnerships at home?
Thank you, Sangeeta. So what really came through in our research was how powerful these group-based settings of what's called the VESAs, the Village Economic and Social Associations, was. And it wasn't just for financial literacy or savings, which is what they are sort of created for. And also this added component included some joint decision-making sessions, some gender roles components, but not IPV in particular. So what was interesting is how these sessions or these groups had the ability to transform interpersonal dynamics at home and strengthen bonds in the community. So what we call the relational and social benefits in addition to the economic benefits. So honing down or focusing on the effect on the household, we found three main areas or pathways through which the VESAs help households to become stronger in their partnership. So participants repeatedly described how the group sessions encourage respectful dialogue and active listening. For many of them, it was the first time they were engaged in a setting or a format like this. These were quite rural areas, and the schooling wasn't very, they haven't reached high levels of schooling. So just the practice of having to take turns in talking, discussing, dialogue, having to wait till the other one finishes to start talking, generated a sort of skills building that then helped at home, because they could also conduct themselves in discussions and in conversations in the way the groups were functioning. And so, for instance, one man told us that being part of the group taught him discipline in discussions, waiting to speak, listening to others, active listening. And this translated into calmer, more cooperative interactions with his wife and children in general. The other pathway we saw was resulted in joint decision or enhanced joint decision making. And this was fueled by new knowledge. So in particular, women gaining new knowledge through the VESAs, meant that husbands felt that they were a partner they could talk to about financial decisions, because they had been discussing that in the groups, and they had this knowledge, which maybe they had before, but they hadn't been able to see this, because in this group that was coming out. So women described being more included in financial decisions. Men appreciated the increased peace and understanding this brought at home. So there was a shift towards mutual respect and validation as an other you could talk to. However, I have to say that this change, we saw it started, but in some households, when pressed, women will say, but ultimately he will take some of the final decisions. So we saw a very important shift, not complete change, I have to say. And perhaps a more compelling pathway for us was how the group created a reference point for behavior, which is a very key important factor for social norms shifting. So the group became like a group of reference and became a mechanism and somehow of social control. Because as I said, IPV wasn't a core topic for the group sessions, but it came up organically. So they were talking about IPV experiences, especially we're talking about early marriage or household roles. It just came up. So participants shared and challenged ideas, sometimes even correcting each other's views at the moment, like saying you shouldn't be doing this, or you could do things this way. And for some women, hearing other stories and gaining support from the group was quite transformative. So one woman shared how the group had helped her realize she didn't have to stay in an abusive relationship. And that kind of empowerment, being able to envision and take a different path, was made possible because of the trust and the solidarity built in the group, but also because they had become this reference group that started, as I said, shifting norms, shifting attitudes. So to summarize, the discussions didn't just increase knowledge, but they provided a platform for modeling and practicing new behaviors, skills, and gave people a safe space to reflect and challenge norms.
Thanks so much, Anna. And Samral, you also tested a cash transfer plus life skills program for couples. And what inspired you to include men in this program? And how did couples respond to learning life skills together? Did you also see, similar to Anna, how like sort of improving communication and conflict skills, conflict resolution skills, if that had a positive impact, for example?
Yes, thank you, Sangeeta. Yeah, so in Pakistan, we have a patriarchal society system. So women usually are dependent on men financially, socially, economically, in all aspects. So this cash transfer program was introduced by the government for women in Pakistan for low poverty settings. So to make women more financially independent. This was one part of women empowerment, but what we did was we added curriculum, the life skills building curriculum, to enhance that program, and included men, which was the innovation in this scenario. So to include men, the motivation was that normally we only look at women, we only work on women, and the men, which are the leaders of the household here in Pakistan, basically. So to have them included, to make them feel included in decision making and in the curriculum that we taught is very important. So they should also know that what we are teaching women, it shouldn't be only women who should be taught. It should be men who should be included, who should feel included as well. That was the main aim. And since they are the decision makers, they should be part of this curriculum, so they can include women in future in their decision making, so they make combined decisions, So we had a formative phase for this study, where females mentioned that if you include men in this teaching, in this curriculum, in this sessions, this will have another impact, like a bigger impact on women empowerment and other aspects in depression, in IPV, in resilience, and in gender equitable attitudes as well. So what we found was in the end, we found that the resilience and gender equitable attitudes significantly improved in the couples arm. So that was, I think, one of the major, the good thing about this program. Thank you.
Thank you so much, Samral, and very interesting to hear about two couples-based program. And now we'd like to move to Fumi, and if you could tell us about your research where you tested an app-based economic empowerment intervention with young girls. So what sort of shifts did you observe in how the girls viewed themselves and their future trajectories after participating in this Girls Invest program in Nigeria?
Okay, thank you, Sanjita. We worked on, it was a randomized controlled trial, and it was app-based with 5 modules with girls from low-income communities who was in school. The program was called the Girls Invest Nigeria project. And the girls reported benefits from participating in the project, and their benefits stated included economic benefits, health, and social benefits. And these benefits crossed across various topics because we did a number of topics as part of the training curriculum on the app. So they reported increased confidence in managing finances and on general financial literacy. They had improved attitudes to gender equity and women's rights. Like my colleague presented, it's basically a patriarchal system in Nigeria too. And then there were reports and quotes from our interviews showing that topics such as menstruation, sexual and reproductive health were well received and appreciated. And then there was increased understanding on what is a healthy relationship and confidence to leave abusive relationships. And the girls stated that they were confident discussing issues with friends. So they became even peer educators. They could broach this topic because generally things like sexual health are things that are not spoken about publicly. So they were able to become peer educators and even spoke about discussing with their mothers, their parents. And lastly, their expectation for their future certainly improved. There were so many quotes to highlight these things, like the girls saying that they now believe that what a man can do, a woman too can do with support, and that they now save their money and do not spend it eating so much junk, and that they now believed that they should go ahead and do some vocational training because these are girls from low-income communities, and they did have incentives like machines, sewing machines, and hair accessories to help them. And then they also felt that they were ready to pursue a bright future. So there were many quotes which time would not permit that they reported using the app. I'll stop here.
Thanks so much, Fumi, and really interesting to hear how program participants sort of benefited and became peer educators themselves or became sort of the reference group as in Anna's intervention. So very interesting to hear about these things. And we know that with any intervention, there are always challenges and outcomes, especially when working in like patriarchal settings. And these interventions, of course, challenge traditional gender norms. So going back to you, Fumi, if you could talk about some of the challenges you faced in making the app accessible to girls without smartphones or internet, some of the more local and logistical challenges you do face when developing and testing interventions, and how did you sort of manage that challenge in your program?
All right. So first of all, our app was basic and simple. It wasn't a complicated app. So we started off with that. We even wanted to make sure that it could work without data, but we found out that it could be slow. So we did provide the young girls smartphones because not all had smartphones. We had installed a program on the app so that they had it already on those smartphones. So we also provided Wi-Fi to ensure that they could participate maximally. And we did have quizzes at the end of each level or module so that they could participate in the quiz, they could answer the questions, and we could assess knowledge. And then each girl was given a unique identifier because it was, we followed them in time, follow them forward. So we gave each girl an identifier so that we could tag their phone and monitor their progress as they use the app. So we could say how long they took on each level, whether they had answered the questions, how long so we were able to monitor at the back end. And then to avoid distractions, we kept the phone at the end of each day because there was concerns by the school authorities and parents that a smartphone is a distraction for school-age children and that they won't read their book. So at the end of each day, we had to retrieve and come back the following day to continue with the training, either during break time or at the end of school. And then to reinforce learning, because most young people in Nigeria are used to using phones, but maybe not all of them smartphones. So we had a booklet to reinforce what was on the app, but that was on completion of the app. So we had a small booklet we produced, which was used to discuss the content of the app to ensure that everybody was in complete or had good understanding. So those are some of the things that we did to ensure that our app was well understood by these young ladies from low-income communities. But we certainly see that there's a need to, we could improve on the app. We got feedback that we could make something which would be, there were vignettes and stories on it, but we could also make it more youth-friendly and have it, the curriculum content could be improved on. So there's certainly room for improvement, but it certainly was beneficial to the girls, and we too were able to manage with at least at a low cost.
Thanks, Fumi, and really important lessons to think through as you sort of design app-based interventions and making sure that these apps work without data or have like backups like booklets. And moving to Mamun, were there any findings in your longitudinal study in Bangladesh that sort of challenged your expectations or made you rethink how we approach violence prevention programming across a woman's lifetime?
Yes, we found some findings which actually challenge our expectations. So, for example, usually treat the factors associated with domestic violence against women as kind of something static. However, our results from this analysis show that these might be different for physical and sexual domestic violence, and that might also change over life course of it. Thus, interventions for women should avoid one fit model for all and may need to be tailored to the factors specific to a life stage. Although we did not have any specific expectation about the association between NGO membership and violence, but we have found that NGO membership as a negative factor for women, as you saw from our presentation. So while researching on the effect of NGO membership on women's experience of domestic violence in the country, in Bangladesh, is inconsistent, a great body of literature actually suggests that NGO membership is a risk factor for domestic violence in this setting. And due to the deeply rooted conventional gender norms and traditions in Bangladesh, women earning more beneficial power than what is actually deemed to be appropriate in the society might threaten the status balance between the husband and wife and also increase the risk of violence, Furthermore, men might use violence as a strategy to gain control over women's earnings as well. Another explanation can be that gaining financial power might increase women's tendency to defy social norms and unfair situations, which might use that lead to more conflict and also violence. Thus, we really think the NGOs who should be more careful, especially who give loans to the women, the microcredit programs. When they will conduct these programs, they should conduct sessions on train the women and also her husband on gender, and also keep them under close monitoring, so that women does not become a victim of domestic violence due to their engagement in economic activities.
Thanks so much, Mamoon. And yeah, I completely agree. It's really important to have some component on gender transformative programming alongside trying to increase women's employment or economic opportunities, especially in very patriarchal settings. And Anna, like from your intervention, I know that you had gender transformative programming. And were there any things that sort of surprised you in how men and women experience the program differently?
Certainly. So this was something that we didn't, from the outset, we weren't looking to find. This is something that emerged from the data. So even more interesting for us because it was very real and they brought it up. So one of the most striking and consistent findings from our study was that the gender nature of how men and women experienced and benefited from the program. So while both men and women valued the group discussions and the financial aspects of VESES, they drew different types of benefits. For men, participation often translated into sort of increased status in the community. They appreciated gaining leadership roles in the groups and being seen as knowledgeable and being able to ultimately fulfill the provider roles more effectively because of access to group savings. One man told us that being chosen as a coordinator in their community made people think highly of them. So for many, it was much more about public recognition and external respect. Women, on the other hand, tended to focus more on the social and emotional aspects benefits. They talked about forming strong friendships in the group, being listened to, sometimes even for the first time, and finding their voice and finding emotional support, especially during hardship. So what was interesting for women is that many women mentioned that these friendships went beyond the formal sessions because it was formed by people in the community. They become that support networks outside the sessions, becoming important sources of advice and solidarity. So it's the social capital that they were highlighting and that they felt hugely empowering, but less so how much it gained them status in the community. It was a sort of more internal or in the household. And we also found some differences in how gender norms were challenged. So while both men and women acknowledged that the group helped shift attitudes about IPV, as we saw in my previous answer, women were much more likely to describe personal journeys of transformation. So like realizing their rights or gaining the confidence to make independent decisions or leaving a partnership. So in that sense, the transformation seemed very deep for women. Or they gave more examples of that while the men were again talking more about the outside world. So I think what was interesting for us is that while the same intervention structured exactly in the same way reached both men and women at the same time, it created different pathways of change. For men, it reinforced the social status and leadership, and for women, it built the inner confidence and external networks of support. And I think that recognizing these differences is really important when thinking about how to design and adapt interventions to be truly gender transformative, because they can look very gender transformative, but the way they're going to impact men and women might differ. So you might want these results, but you might want to enhance women's status in the community as well. So you need to think about that. And you need to do something a bit different for women because clearly with the same intervention, you don't generate the same impact.
Thanks, Anna. Very interesting results and how, also these pathways themselves are quite gendered. So important to think through different pathways for women and men. And moving over to Samral. And so from your couples-based programming, again, I know you conducted a cost-effective analysis, which is quite innovative. What insights did the cost-effective analysis offer for prioritizing investments in integrating IPV and mental health interventions?
Thank you, Sugita. Normally, what we think is what is cheapest is the best, but it's not the case. That's where the health economist's role come in. So the interventions that are being implemented should be taken into account with their impacts. So we had this evidence from the literature. I can quote an example from What Works one project that was based in different countries, and they also focused on mental health and IPV. So they had promising results. So based on those results, we had this idea to do this kind of analysis for our project as well. Because we had similar outcomes. So to have those outcomes, we wanted to see if couples intervention or women only intervention is cost effective. And currently we are working on a scale up of this project. So we are still looking at the figures right now, so I cannot share that currently. But yeah, there is something coming up.
Thank you so much, Samral, and thank you all for your fabulous answers. I'm now going to open up the floor for questions from the audience, and I can see we have some great questions already. So I'm just going to start with one. So we have a question from Ines for Anna. Did the curriculum include components explicitly focused on communication skills, or were those skills developed more indirectly, maybe through group discussions or other interactive elements?
Yes, they included aspects of communication and active listening and specific skills, and they had the ability to practice it through the meetings. What I have to say is that the curricula were like one-off sessions as well. So it wasn't like a curricula and an intense curricula where you have like the ability to develop it through various sessions. So it was one session on communications, one session on household decision making. But then what they did was like through all the other meetings, they could practice things that they had learned.
Okay, that's really helpful to know. We have another question for Mamoon, which is from an anonymous attendee. Did you have data to test women's asset ownership as a correlate? And yes, if yes, what did you learn?
Okay, thanks for the question. Actually, we did not test women's asset ownership as a correlate, but we tested women's income generating activity status as a correlate. And in terms of ownership asset or something, I mean, we used socioeconomic status of the household, not the individual asset ownership of the women.
Thank you, Mamoon. And there's a question from Abdul Rahman for all of the panelists, so anyone can answer. To what extent are the experiences that you all discussed during the sessions, how could they be sort of replicated in different contexts? So how could so if anyone wanted to sort of adapt your interventions for different contexts, what would your suggestions be? Who would like to kick us off on the answers?
So can I go first?
Go ahead.
Yeah,
Manu.
so I wanted to make one point. I mean, Somral has mentioned that about the couple sessions, the effectiveness of the couple sessions. And in one of our other studies, we also found the same results. I mean, when the sessions were given to both husband and wife, then we found that it could reduce violence against women. And it was happened only for the age group 15 to 19, I mean, the married adolescent girls, and not for the other women. So, I mean, since we are seeing that these kind of findings are coming from Bangladesh and also from Pakistan, so at least these are applicable for South Asia and Asian countries. So it could be, I mean, one takeaway message from to the session.
Thank you so much,
I don't know,
Mamoon.
can I come in here too?
Of course, Fumi.
I would, yes, I would like, sorry, I don't know if you were going to talk.
No, go
Should I?
ahead.
Yes, because my internet is a bit unstable. So I would advise that that everybody, or researchers, program managers, everyone consider conducting research using mobile apps, because the app, the phone, smartphones is becoming, the coverage, the use is increasing everywhere, particularly among the youths, among adolescents and youth. So, and it's a form of intervention that is able to reach the youths and the young people very well, because they are always on their phones. It's a very good medium of passing message, health information, of health educating young people. So it's a research that I would advise. I will be happy that other researchers also come on board and do, because it's an effective way of changing attitudes, improving knowledge, and hopefully influencing practices. And our methodology, what we did, both the strengths and the limitations of our study, we have published. We had shared that earlier with Sanjita and Liz of SVRI. So this can be, we can search for them on the net and pick them to look through what we have done and even improve on it. We're happy to correspond with whoever wants to do this. Corresponding address is there. So it's a way to go, and it's what I would recommend for many. Thank you.
Thank you, Fumi.
Hi, can I?
Of course. Go
Yeah.
ahead, Anna.
I just wanted to focus on the group aspect of things. I think this is quite an implementation thing, but we tend to focus a lot on the gender transformative content, but I think the format can also help. So giving it a lot of thought in terms of not just delivering content through couples and groups of couples, but also thinking about, do they know each other or not? How many interactions are they going to have? Because what we see in the literature and in this project is that if you tap onto a network that already know each other, then the effect is much bigger because they can come a reference group much faster. Plus, you create this social network that sort of has an impact beyond the sessions because they keep the interactions and they keep talking about things. So thinking about who's in the group, if they know each other, how many interactions they have, can also be quite powerful, not just thinking about the content.
That's a great point. It's really important to sort of build a cohort and this we're learning both from your intervention, Anna, as well as Fumi's intervention. So really important to sort of think through that. And we have one question from Wendell about sort of tracking progress over time. So if for all panelists, so like what are plans of tracking progress over time? When are your next sort of measurement time points and what are plans for that? Who would like to go first?
I can
Go ahead, Samar.
add here. So for our project, the timeline was limited and the funding was limited, so we cannot go beyond that. But to have that impact nationwide, we are going to pitch in the scale up for this project to the government so that this can be spread out nationwide. And this could have a significant impact like in terms of sustainability of the project that we have done. So the curriculum that was made, it will not go waste. So it will be going towards the mass. This can also be replicated in other countries with the similar settings like Mamoon said. So this is one of the way of sustainability of these kind of projects. Thank you.
Thank you, and really emphasizes the challenge in doing long-term sort of follow-ups, you do need money and investment for that. Anna, for me, were you wanting to come in to answer?
Just to say that the results of the study we did was on SPUR 1, but then there's been a SPUR 2 that run between 2021 and 2026. And I think they are also evaluating it more from this sort of food security perspective. I think the trial is also including some IPV measures, but in terms of this group component, we didn't continue this because we had established it in this first phase. But the evaluation of this program, that is huge, is one of the biggest in Africa. It's continuous, and there are more results led by IFPRI on the trial.
Thank you.
Okay, thank you. From our own end, our program too had a timeline, so it came to an end. So we couldn't, even the students too graduated from school, some of the classes had graduated. But then we have the tools to continue to sustain the program because we formed a community advisory board, which still remains in place. We had collaborations with the Ministry of Education of our state, of whom we still continue to maintain a good working relationship with, and they were very well part of this program and saw its benefits. So they believe it should be cascaded to other schools. And then lastly, the booklet we were able to make to reinforce the content of the app that we still have so many copies of, and we continue to distribute and disseminate. And lastly, we believe that some of the girls that we have trained who have been beneficiaries of the Girls Invest project will continue to step down their knowledge and their training informally and formally wherever they go, and even in the school and in their homes. So we believe that some sustainability would be in place since we have completed the research.
Thanks so much, Fomi. And we have one last question on methods from Helen to all panelists, asking about the methods that you use to maintain confidentiality in your interventions. And again, really important question. So I'm just going to open the floor to anyone who'd like to elaborate on that.
Sorry, the question is confidentiality on the interventions or on the research?
How did you maintain confidentiality for participants who sort of participated in your research?
I can start.
Go ahead.
So we obviously, because we were talking to couples, they probably knew in the community who was participating. So within the community was they could choose to tell others if they had participated in focus groups or in interviews. But what we could do is manage the confidentiality and anonymity in terms of the transcripts and quotes. And so we researchers never had names, for instance. Only the people collecting the data had the names and contact numbers to contact people in the field, but researchers, we never got any names. We just got ID numbers and age and which ward that they were part of. And in all of our reports, that's how we report what they said. So we had verbatim quotes, but it's impossible to link them back to who said that in which community.
Great. Thanks so much, Anna.
To add to
what
Anna said, we did similar to just what Anna said. They identified the data, but we also made sure that the interviews were done in a private area. We didn't do it where anybody could hear. So we had the support of the school authorities who designated a small room for us where we could do the interviews without anybody else hearing what the young girls were saying to the interviewers. Thank you.
Thank you, Fomi. Yes, Mamoon.
Yeah, to add, I mean, that in the focus of the research, on violence against women, which is a very sensitive issue, becomes widely known, either among the wider community or, within the household, the topic of the interview may become known to a perpetrator of IPV as well. So for this reason, we usually ensure that the research topic does not become widely known. So this is the first point to use, and to enable the respondent to explain the study to others safely, the survey, we frame the survey as women's health and well-being survey, and introduce the survey within the community and in the household as well, similarly. And when we need to, explain the objective of the study, then we do it with someone who is, knowledgeable or maybe influential within the household. In this way, so that people do not become curious to hear what is asking to the participants. So that is also another way we use, and definitely we use we do not interview the participants in front of others.
Thank you so much, everyone, for this really rich discussion. And it's really important research out there. And thank you so much for these tips on how to maintain confidentiality as well. We're looking forward to sharing the inputs from your research. So if you have any research papers or outputs, we can definitely share that with the field. And with that, I'll hand over to Simone for the closing. Thanks, Simone.
Thanks, Sangeeta. Thank you all so much for joining us today as well to explore the evidence around what drives and what can help reduce intimate partner violence. We've heard how women's financial stability, stronger social networks, and shared decision-making can lead to safer, more empowered lives, and how involving men and investing in life skills can be a powerful, cost-effective way to support lasting change. A big thank you to the SVRI for hosting this series. On behalf of the Australian Volunteers Program and the SVRI, we'd like to sincerely thank our speakers, Matmun, Anna Maria, Samra, and Fumi for your insights, to Joy for grounding us in the forum findings, and to Sangeeta for helping us unpack these insights with such care and focus. Before we wrap up, a reminder that Forum 2026 will take place in Bangkok in October 2026. This will be a global moment for researchers, practitioners, activists, policymakers to connect, share, and learn together. Abstract submissions and registrations open in August 2025, so please keep an eye on the SVRI's website and social media for updates. And to stay connected, also don't forget to sign up to the SVRI newsletter. So once again, thank you for tuning in. A big thank you to our speakers, and good night from me in Melbourne, Australia.
Thank you. Goodbye, everybody.
Thank you.
Thank you.
Thank
Bye.
you.
Thank you,
Bye
everyone.
bye.
Goodbye. See you next year.
Mhm.